Commissioner Manfred just deserves a tip of the cap from the whole industry, as does Tony Clark, for coming together and getting an agreement together to move forward on health and safety protocols. This is an experiment. It is a high wire act, to be sure, but the players are taking it seriously. We're taking it seriously in our facilities, and now we need to execute. It is critical that we get fans back in the stands at some point as soon as it is safe and the government and health officials say we can do it, both at Anfield and at Fenway Park. For baseball, we rely on gate revenues, 50+% of our revenue. So as you can imagine, this has been devastating for the business.
Mexico City, downtown, ¿dónde comer? Pues aquí vemos fácil 2,000 o 3,000 restaurantes en el centro, pero popular, porque es un restaurante donde venden comida sencilla, como chilaquiles, milanesa, enchiladas, huevos, café con leche y el pan. El pan es muy importante. El pan lo fabricamos aquí con materia prima de muy alta calidad y un sabor muy especial. Nosotros somos un referente en el centro, en la ciudad, en el país y en el mundo. La conversación principal es: no hay dinero, no hay un peso partido por la mitad, no hay nada. Y hemos pasado por varias, desde incendios, los temblores, el HNN1, todo ese tipo de... las crisis de devaluación, o sea, nunca había sentido esta situación de estar en una línea tan delgada entre la quiebra y seguir trabajando. Así, si hubiera venido usted la semana pasada, no hubiera una mesa. Ahorita tenemos por lo menos 5 o 6 meses. Pero no es suficiente.
Sí, es muy triste ver que, por ejemplo, en este caso aquí, siendo un restaurante con las filas en toda la banqueta, sea ahorita solamente así poco lo que se ha visto. La gente, los clientes, este restaurante a reventar, estando todas apuradas. Bueno, uno como mesera, todos, en general todos, apurados por llevar el servicio y rápido y todo. Eso es lo que más extraño.
La recuperación económica va a estar muy, 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 muy difícil. Y no nada más para los restaurantes. Tenemos que salir adelante, a pesar de muchas cosas.
The sheer number of patients we've had to take care of at the end of life has been overwhelming and surreal, to say the least. In terms of mental health, this has definitely taken a toll on our nurses, our fellow physicians, all of our healthcare staff, including our trainees. And so we've had to be very thoughtful about creating programs to attend to everyone's mental health needs. Some of those include virtual first aid groups, psychological first aid groups through the Tulane Department of Psychiatry and the LSU Department of Psychology, as well as doing the things such as the daily check-ins with our teams. So making sure that we're doing daily check-ins with our nurses, our trainees, our fellow physicians. If nothing else, we have to learn the strategies of how to keep coming back every day to work and how to live through that.
You need to be able to talk about how you're feeling and to reach out to someone. And don't just keep saying, I'm going to work today, I'm going to do this, I'm going to do this, I'm 10 feet tall and bulletproof, right? Yes, over time, we all are vulnerable and we'll start to break down no matter how good we are. I think for our frontline responders, the important thing is that self-care becomes a part of their daily routines. And it's embraced by the medical, and behavioral health communities, that it becomes part of your job. It's not something you do after or before work or something that you know is another add-on. It's important that we stress the need for self-care, make it a priority, just like wearing a mask is a priority to stay safe. Taking care of your emotional and mental needs should be a priority too. That's just what we need to do.
Medical bills are just outrageously coming in and they're piling up. Me being sick, so bills started piling up, and so it was just really got harder for us because it was like, how are we gonna pay this and where the money gonna come from?
My message to lawmakers can be one thing is really take a day and walk in the shoes of the families who have to make these critical decisions. Particularly when you're thinking about ending the support of the $600.
Best practice.
Everybody here wants to just benefit the patients that we are having. Everybody here wants to just do good for the people. It's not about anything but the patient welfare actually.
Access constraints are having a knockdown effect on operations, but we are continuing to deliver, for example, medical assistance and materials to people who are living rough, whether they be migrants or internally displaced people within Yemen. The situation is especially dire in places like Aden, where hospitals are turning away suspected cases, and news reports have shown large numbers of graves being dug.
The decision came pretty quickly over the last 4 months. Once the lockdown happened, we decided we no longer wanted to be in an apartment building and we wanted to have a little bit more room for our family.
I think the pandemic really caused the glue to hold the commitment we had to Manhattan to fall away, because since the banking and the technology companies have said to their people work from home, there's no need for us to be there to service the mass population.
Right.
So if everyone's working from home, we will too. Dining out.
Restaurants, bars, New York City nightlife, Yankee Stadium. everything about the city. You know, we still love the city, but with the way things are going right now, like I said, I think it's a good move for us and our family.